Good afternoon. My name is Saida Lopez. the epidemiology manager for the Houston Health Department. Today, I want to talk to you a little bit about MPOX. MPOX, also known as monkeypox. Monkeypox is a disease caused by a virus that is currently circulating in our community. And although overall numbers remain low, we have seen recent uptick in cases, and this is not often we don't hear much about mpox often. So I did wanted to talk a little bit about this because even though the risk to the general public is low, we still have some groups in that are at higher risk for infection and others that are at higher risk for severe illness. um, a little bit about symptoms regarding mpox. People with mpox often develop symptoms like flu-like symptoms, along with other like rash or sores. The illness may begin with fever, fatigue, swollen lymph nodes, and also some general body aches. And then after a few days, people will develop a rash or sores. However, some people may just develop the rash or develop the rash before other symptoms. So the rash is very characteristic of this infection. Um, and, you know, a person with mpox can spread the virus from before symptoms begin um, until all sores and the rash has healed completely. That means that the scabs have fallen off and new layer of skin has formed. And this process may take several weeks to, for the sores and the lesions to be healed completely. Um, in terms of how mpox spreads, it is primarily spread through close personal skin to skin contact with someone who has mpox symptoms, right? Especially the rash or sores. Um, what constitute a close contact? So things like kissing, hugging, a prolonged face-to-face interaction with someone who has mpox, and also intimate sexual contact with someone with mpox. Certain high-risk activities can also increase the risk of getting mpox, such as having unprotected sex, or having multiple sexual partners, or having casual or transactional sex. So those are activities that may increase your risk of getting mpox. Um, Also, touching objects or surfaces that have been in contact with the source or body fluids of the person who is infected with mpox can also pose a risk, although this is less common. And because people with mpox who have mpox are contagious for the entire duration of the disease, which is typically 2 to 4 weeks, they should avoid contact during all this time with other people, as well with also with pets or animals, until they are fully recovered. And that is until all the sores have healed, the scabs have fallen off, and then a new layer of skin has formed. That's when it is considered a person to be completely healed or over the disease. Um, this period of 2 to 4 weeks may extend depending on the person's like health status. So it is very important that we are aware that all the scabs, the sores have fallen, the and all the sores have healed completely. Like I mentioned before, some people may be at higher risk of developing severe illness, including people who are immunocompromised, such as people who are living with HIV. Also, younger children, like under the age of 8 years old, and 8 years old, and especially those under 1 year. Also, people who have history um, of health of skin conditions like eczema might be at higher risk for developing severe illness, and people who are pregnant or breastfeeding. Um, there is no specific treatment at this time for mpox. However, a healthcare provider may prescribe over-the-counter medications or other prescription treatments to treat those symptoms, not, mpox itself. There are some antiviral drugs that may also be used for people who have severe illness, or who are likely to get severely ill. Um, so those are available as well. The good news is that there is a vaccine available to prevent the disease or to reduce its severity. It is We know that most of the cases that have been reported are in people who have not been vaccinated, and we know that getting one dose of the vaccine reduces the chances of getting mpox by 75%. And if you with the second dose, that chance of reduces it reduces the chance of getting mpox by 86%. So and that is the recommended series, like 2 doses. And a person is considered fully vaccinated after 2 doses, after 2 weeks have passed after they get their second dose. And that's where they have the maximum protection against mpox. I do want to highlight that regardless of the vaccination status or past infection, if you develop symptoms that align with mpox, or believe that you may have been exposed, you should still get tested um, for mpox. Um, Vaccination is strongly recommended for people who may be at risk for mpox, especially those at higher risk for severe illness. And we mentioned those before, especially those that may engage in high risk activities like, unprotected sex and having multiple sex partners, or engaging in casual sex. Those are at higher risk, and vaccination is highly recommended for these groups. Um, if you believe that you are at high risk for mpox, you can call the Houston Health Department Client Access line at 832-393-4220 to get information about the vaccine or to access the vaccine. If you or someone you know develops symptoms, if you notice like a new or unexplained rash or sores or other symptoms that are consistent with mpox, seek medical attention for evaluation. And please notify your healthcare provider that mpox is circulating in the community. During this time, you should avoid contact with others, like we mentioned before, while waiting to be evaluated, or if you are waiting for your test result. You should not be around others during this time. If you do not have a healthcare provider or health insurance, you may also call the 832-393-4220 number for assistance and to get help, assistance to get tested. What to do if you do test positive? So, if you do test positive, you should stay home, stay isolated. That means to stay away from others. If you must be around others, so you should take extra precautions. You should cover your rash with clothing or bandages. Use a well-fitting mask, um, and try to maintain distance from other people. You should also clean and disinfect your home or share areas in your home, and notify anyone you may have been in contact with during that time of your infection. So, um, and since your symptoms started. Um, if you tested positive, something to keep in mind is that if you live in the Houston area, um, HHD, someone from the Houston Health Department, may be contacting you to monitor your health, to ask about recent exposures, and to um, contacts and provide you with support as needed. Um, Please, if you do receive this call, please cooperate with public health staff to help prevent the spread of mpox in our community. And then I am available for questions. This is all the information I have for now. So the first question is, once my mpox symptoms go away, how much longer should I stay away from the public? So you should be completely So once all your lesions, your sores, your rash has healed, like I mentioned before, and your scabs have fallen, and you have new skin, you should be you should be able to go in public, right? If you are someone who are immunocompromised, and this may be prolonged for a little bit more, of course, take extra precautions, and use your mask, use some long sleeves, just protect yourself, and stay away from others if you do not feel well. Is the MPOX outbreak still active in Houston now? No, we don't have an outbreak going on right now, but we have seen some um, a slight increase in cases in recent months, and we wanted to give a little bit more information about it, about how to get vaccines, about how you can get tested, if you and give you more information about all the symptoms and the resources available. So you can call our number if you want to know a little bit more about MPOX, and then you can also visit our website to get more information about it. Thank you so much, and have a great afternoon.